What we're doing here is refurbishing Parkview Clinic. Two out of the three wards, the third has already been done. So we're going to refurbish Ashfield and Heathlands. Both wards have got dormitories at the moment, and so the main driver is to get rid of those, replacing them with single ensuite accommodation for all patients that need to spend some time here. It's going to be completely transformative in terms of the care that we're able to provide. The clinical care is really good already. The reality is the building just isn't. In terms of moving to ensuite rooms, it will mean that young people have got a place of where they can go and have some time for themselves. You know, some of the young people are with us for some time, and so having their own room, somewhere to call their own, is really important. For some young people, being in the vicinity of another person who might be anxious or escalating can have a negative effect on their own recovery as well. So from that perspective, it's also really important.
I was an inpatient at Parkview, so I was in hospital for about 4 years in inpatient units, and I came to Parkview for my last inpatient stay. I came from a secure unit, and so I went from the secure unit to here to reintegrate back into the community and go to a step-down unit, which was Heathlands. And so I kind of started doing activism and volunteering work with Think for Brum, which is the youth mental health advisory group for Forward Thinking Birmingham. And I spoke to Sarah Jane Marsh and kind of talked about how maybe Parkview wasn't fit for purpose. It might not have been especially safe or therapeutic. I think it will help young people to feel that it's more of a therapeutic environment and more homely. Often inpatient is quite a scary place. It might be physically safe in terms of restrictive, but it might not be emotionally safe. It might feel really scary. And so I think what I'm hoping is that this new building will kind of try and ease those worries and make sure that young people are in a safe, emotionally safe place, and also a therapeutic space where they get their own kind of private area to just chill in, and that there'll be more therapy rooms to allow for kind of different activities on the ward. So I think it will just be loads better for young people in terms of making sure that it's not an institutionalised environment.
It's massively important. I mean, mental health services are one of the most important parts of what the NHS does, and are one of our most important services at BWC, and I think they've been a little bit left behind in terms of the investment they need in facilities so that we can match the buildings to the care that we provide. So it's such an important moment, this is, and one that I feel like we've been waiting for many years. Well, young people have been instrumental in this coming to life from the outset. I mean, it was their idea. They directly challenged me when I went to join one of their Saturday meetings and just said, you know, do you think this is good enough? This has been our experience. Would you be happy if this was you or your child? And it really set the ball rolling. And they've been involved then all through in terms of the design of the buildings, particularly people who've been inpatients themselves. They know better than we ever could about what's needed. So it will definitely be a unit for young people, designed by young people. I also want to say a massive thank you to the clinical teams. I mean, they're so dedicated to the care that they deliver, and they've been making do for years, probably when they shouldn't have been making do. So their input has been really critical as well, and their leadership. And there's going to be some difficult months ahead when you're doing a construction project. It's exciting, but also awkward at times. So they'll be really instrumental in making sure that we get through the next months and continue to provide the best care we can while this is a building site. So I just want to pay a big tribute to our clinical teams as well for all of their leadership.
The business has been working at NHS all through the history and all through COVID. And to be fair, it's a great client to work with, in that you feel you're contributing to great things within our local region. And you know, it gives you a warm feeling when you do these jobs, because what the fabulous work the facility does to help that, and we've been part of that, we're really proud, to be fair.